So in this video, let's explain the pathology of jaundice, right? So first of all, let's define what is jaundice. And the jaundice is simply the idea that we have some sort of bile, bilirubin, in the blood, and so sometimes clinical presentations may be, yellow teeth, skin discoloration. So this yellowing of certain organs exteriorly is a sign of jaundice. So let's talk about what really happens and what we see in jaundice. So here are a schematic diagram of my gallbladder, and this is my bear my ugly drawing, but this is my duodenum, right? So this is the second portion of the duodenum again, and this is my ampulla of Vata, right, where the main pancreatic duct and the bile duct meets to drain into the duodenum. Now, normally, bile is actually produced in the liver. So bile is produced in the liver and stored in the gallbladder. So bile will travel. So bile will produce, and these are my left and right hepatic ducts from the liver. So bile produced from the liver come all the way down to my common hepatic duct, and then it could just squirt up into the gallbladder for storage. Now, jaundice can be caused by a plethora of conditions, but it's usually most commonly by gallstones. So I'm gonna use these as my gallstones. Now, gallstones, if typically the cholesterol is too high in the blood, there's a chemical imbalance within the bile, and so these precipitate to give you gallstones. So gallstones, the gallbladder, remember the gallbladder is under contraction from CCK, right? That's the hormone that contracts the gallbladder to dispel bile into the bile duct that it could eventually uh, drain into the duodenum where it emulsifies the fat, etc. That it's coming from your stomach. Now, what can happen is that these gallstones could actually uh, block the common bile duct, and so what occurs is that bile coming from the gallbladder can no longer pass to be drained into the duodenum at the hepatic duodenum ampulla of Vata, right? So that can occur. So what happens is that bile actually travels up back to the liver where it could actually get into the blood. Now, when the gallbladder contracts under CCK, uh, patients might come with uh, pain, and that's called a biliary colic, right? So biliary colic is essentially uh, the pain kind of comes and go, and it's the idea that the gallbladder is contracting these gallstones into the bile duct. Now, obviously, we spoke about, and that's how we create jaundice, right? Bile will actually flow back up to the liver, where it could actually drain, into the blood. Now, let's ask some series of questions and let's see if we understand the concept. Now, let's say if I have a blockage in, let's say, the right hepatic duct, will I see jaundice in the patient? Right? The idea is no, right? Because the left could still drain. So the bile will transfer from the left, or in this case, the right. I'm sorry, right? This would be my left. This would be my right. But you get the idea. It will transfer from the right and go all the way down where it could go into the duodenal papilla, right? So obstruction here would not cause any problem. Now, if I block the common hepatic duct, bile still will be able to drain from the gallbladder, right? So bile will still be able to drain from the gallbladder, so we're good in that case. Now, one of the things that occur is acute cholecystitis, and the idea is that we get some pain in the upper right quadrant, obviously because the bile duct is located in that portion, and so we might get some diaphragmatic pain, or we could get some actually pain on the shoulder tip. And the idea is that the gallbladder can become inflamed where it contacts the parietal peritoneum and or that diaphragmatic surface. And again, we talk about a diaphragm being innervated by C3, C4, C5. Well, the C4, C5 dermatome, that's within the shoulder. That's within the shoulder region. And so you may find shoulder tip pain from that. Now, one of the things that can also occur is that we could have these gallstones stuck in this ampulla of Vata. Now what that does is that that causes obstruction. So the infected bile, now instead of draining it, it could actually go to the pancreas. It could actually go to the pancreas, and so that can lead to pancreatitis. Right. So in addition to the gallstones that we've seen, we could also get pancreatitis from the gallstones being stuck into the duodenal papilla. Right. Now you could get that from pancreatitis, but also you could have pancreatitis. Let's say you have a pathology in the pancreas initially. Remember, the pancreas is somewhere around this region, and if the pancreas get inflamed too much, it could actually compress the bile duct as well. So if we have a clinical pathology where we may have an inflamed pancreas, the pancreas can grow and actually compress the bile duct, and in this case, bile wouldn't be able to drain, so you get jaundice as well. So pancreatitis is one of the things that can lead um, to jaundice, as well as gallstones being stuck in the common bile duct. And we just said that if the pathology is from a gallstone, some of the gallstones can actually be lodged into the ampulla vata, and then bile could actually travel and go to the pancreas and cause pancreatitis. So it goes both ways. And so that's the idea behind jaundice. Now let's say, and let's ask one more question. Let's say the pancreas, or the pancreatic duct, the main pancreatic, is blocked. All right, so this is blocked. The question you should ask yourself: would the patient present with jaundice? And the idea is no, right? If there's no gallstones here, bile from the liver will still be able to transfer all the way down and drain into the duodenum, right? So an obstruction of the pancreatic duct would not, in fact, would not cause jaundice. So we're really talking about two pathologies that may cause jaundice, right? The blockage from the gallstones and uh, the hepatic duct, or the common bile duct, and we talk about the inflammation of pancreas compressing that duct as well. And I'm sorry if I said two, but the third one would be gallstones. I mean, it stems from gallstones, so it still would be two, right? So the third one would be gallstones being stuck in the ampulla vata, and that would cause pancreatitis, as well as bile not being able to drain, so it goes straight up back into the liver and then into the blood. So that's essentially the idea behind jaundice.